Welcome to the NextGen Medical Student Training video. If you've not already done so, please make sure preferences have been set by following the steps in the Preferences workflow document or through the video. We're going to go ahead and start by going over the NextGen layout and the icon functionality. The first thing here is going to be the location and the provider name. Now these are going to be set in your preferences, so they will auto-populate when you automatically log in. However, in the event that you need to change this information, you simply need to select the drop-down arrow, find the provider name or location you're wanting, and select that. This information will drive your encounters, so please make sure that those are set to the correct location and provider name. The next icon over is going to be your patient lookup icon. Go ahead and select this, and it's going to launch your search window. We prefer that you search by the patient's birth date if that's available. In the event you don't have that information, you may also search by the patient's last name and first name. Select Find, and it's going to find any patient that meets that criteria that you've entered. To open up a patient chart, simply double-click on the patient name. Once the chart has been loaded, we can then see the patient's name here at the top along with their date of birth and age. We also see the patient information panel here, along with the patient history panel on the right-hand side. You'll also notice that this history icon is highlighted. This lets us know that the patient history panel is viewable. If I select it, it will automatically collapse my panel for me, and selecting again will bring it back. Let's go ahead and look at the patient history panel here in a little bit more detail. We've already talked about the location and the provider name here at the top, and this information drives this encounter. And you'll notice underneath this encounter, you'll see template icons as well as document icons. Now, all information is entered into templates within NextGen, and then the documents are going to extract that information from the template and format it into a document. Each one of these folders is going to be considered an encounter. Now, this may be an office visit or it could be a communication as well. You will also notice additional icons, and we will go through these in more detail at a later time. Within the patient history panel, you can also access the Categories tab. Categories is going to be our filing system for this specific patient. Each one of these folders is considered a category, and within that are going to be documents. You may notice under some of the categories a scanner image. This indicates that a document was manually scanned into the patient chart. Whenever you see a blue check mark next to a document, this indicates that the provider has electronically signed off on this document. If it were to show a white flag instead, that indicates that that document is waiting in the provider's PAQ for sign-off. If you do not see a flag or a check mark, but you see the scanner image, that indicates that the document has been directly scanned into the patient chart without any review. Categories is a great way to find information quickly on your patients, especially for med students that are trying to get a quick summary of the patient's history. This first category here, the FPIM Peds, whenever you see a master IM, this is going to be the final document that was generated from an office visit. Within categories, you're also going to find imaging, diagnostics, labs. You will also notice on the patient history panel that there are more icons down here, and some of these icons are the same as the ones up here. Those icons will take you to the same location. Please be aware that if you're in a patient's chart at the same time as a clinician or a provider, that you will need to come down to the very bottom drop-down list here and select Refresh. This way, you have the most recent information if there is someone else documenting in the patient chart the same time that you're in it as well. We'll go ahead and look at the patient information panel as well. Selecting the patient name is going to launch their demographic window. These buttons across the top all have a hover functionality, meaning that putting your mouse over these buttons will automatically drop down the information held within that template. This patient here has 2 alerts added in: their allergies, problem list, previous diagnoses, active medications, and if they had any future appointments, those would display here as well. Please keep in mind the difference between the problem list and the diagnoses is going to be that your problem lists are going to be those chronic ongoing conditions that providers are managing. Your diagnoses are going to be any assessments that have been billed to the insurance for a reason for visit. Down below on the patient information panel, you're going to notice blue text. Whenever you see blue text, this indicates that it's a hyperlink, just meaning that if you select it, it's going to launch another template. You'll notice that 2 of these are purple. This indicates that there's information residing within that template. Okay, now that we've covered the patient information panel as well as the patient history, let's go ahead and take a look at the inbox icon, which is our 3rd icon listed at the top. Selecting this is going to launch our workflow inbox. And as medical students, the appointment tab is going to be the one that you will be working with mostly. Over here on the right, you should see that your provider's schedule or resource is displayed here. In the event that it's not, or if you need to look at someone else's schedule, selecting this drop-down is going to list all available resources. To change your schedule, unselect the current one and select the new one. You can also have multiple displayed at one time. In this event, I'm just going to go ahead and keep Dr. Barkos so that way I can look at today's schedule. The labels across the top are going to indicate just additional information for you in regards to the appointment. So here we have the patient name, subject is going to be the event type used, and then the reason for visit. You'll notice that your status will change throughout the visit. It's going to go from a kept status to ready for nurse and then ready for provider. Once your provider has finished their office visit note, the status will update to document done as well. When I have this patient selected, you'll notice in this bottom right corner that the patient's name and information displays very similarly to the patient information panel. Same thing here, that there's the hover functionality with the buttons as well. Over here on the left, if you wanted to see previous schedule or future schedule, you can do so by simply selecting that date of service. As medical students, you're typically going to be working out of this appointment tab on a day-to-day basis instead of using the patient search functionality that we reviewed at the beginning. So to launch a patient chart from the actual inbox, you simply need to either double click on the patient name or single click and come down here to chart. And then I can verify that I'm in the correct patient chart with the right location, the right provider, and that I have the right encounter selected for today's visit. Once you open a patient chart for an actual visit, this is typically the view that you're going to see. What this shows us here is that an intake has been started by the clinician as well as the histories reviewed. As a medical student, I always recommend starting on the actual homepage as a quick chart summary review. And to get to the homepage, we can do this a couple ways. The first way I'm going to show you is by going to this icon here at the very top, which is going to be your template icon. Go ahead and select this icon to display your preferred templates that were saved during your preference setup. You'll notice that there's a homepage GP840 listed. Go ahead and select that and then OK. So this has now launched your homepage template for you, and what this template is it's a chart summary. So it extracts all of the information from all providers within our network. And so if I select HPIs, I'm going to see every reason for visit that the patient has been seen, and you'll see the documentation associated with that reason for visit. The easiest way to work with this information is going to be using the filter by reason for visit or filter by provider. To utilize these filters, select the blue drop-down arrow, and this is going to give you every reason for visit that has been entered in on this patient. Now please keep in mind that there may be very similar reason for visits, but the description may differ slightly, enough so that it's going to create a duplicate entry. We recommend to use the filter by provider in order to avoid that confusion, and so to do so, all I need to do is select the drop-down arrow next to provider, and then I can search for the provider that I'm specifically looking for. If there's no information or I need to clear out my filter, all I need to do is select the clear button, and it will return me to my original display. I can do the same thing with plans. So over here on the left hand side, if I select plans, I can filter by diagnosis, or again I can filter by the provider. And I can do so by selecting the drop down arrow, and here it's going to show me all the diagnoses that have been entered in on this patient. Or I can also use the filter by provider, and this works in the same manner as the HPI as well. Down below here, you'll see here's my assessment, and then down underneath that same visit date is going to be my plan orders that were entered in for that visit. You may review the other available options listed on the left-hand side underneath this medical chart panel, so we can also quickly see previous labs, diagnostics, vitals, previous physical exams, and so on. Please keep in mind that again, this is a view only and no documentation can be completed from this current template. For medical students, I highly recommend utilizing this as a quick way of reviewing your patient's chart, along with utilizing the categories tab found here on the patient history as well. This will prevent you from needing to go through your patient history encounters and trying to find this information by opening visit by visit. Now that we've reviewed the homepage template, the next thing I want to do is just quickly review the information that your clinicians are going to be gathering during the rooming process. Now, a lot of this information I'm going to show you is going to also display on your SOAP note, but just so we have some idea of how these templates work and the information they're gathering. So go ahead and select your intake tab here at the top. And the first thing I want to show you is the panel control. This is just going to help us navigate our view. And so if I select this collapse all, this upward arrow here, it's going to take all of the panels that are present on the intake and put them into a nice order. I can then quickly see the information just by clicking on the title. So as you can see, they're going to be entering in the reason for visit, gathering vital signs, reconciling medications, reviewing allergies. They will also go through and do a review of systems as well for all of their patients, and then they'll also reconcile any orders that are outstanding. The next thing that most clinicians do is a histories review. So up here at the top next to intake, the next tab over is going to be histories. Go ahead and select that tab. And the first thing I'm going to do again is going to be to collapse all of my panels so I can quickly see what's available on this histories template. So we have a chronic problem list. Now this panel here is going to be maintained by the provider and not by the clinician. Keep in mind that the problem list is going to be your chronic conditions. So these are the ongoing care items that your either family practice or specialists are going to be managing for this patient. Your clinicians are going to be obtaining a medical, surgical, and interim history and updating that information as well. If your patient had any outside diagnostic studies completed, those are going to be documented here under diagnostic studies. Review and update family history, as well as the social history. This includes tobacco and alcohol use. Okay, next we're going to review the SOAP template, and this is going to be the provider's workflow. So up at the top again, the middle tab is the SOAP template. Go ahead and select that. And I'm going to collapse my panels. And you're going to notice that these panels are very similar to what was already on the intake, except for a couple variations down at the bottom. So the first thing that your provider is going to do is they're going to start with the reason for visit. Now the clinicians have likely already added what the patient's coming in for today, and the provider can add additional reason for visits or change what's already been entered by simply coming down here to the additional manage link down here at the bottom. So if I select this, I can then go ahead and add in another reason for visit, or I can change what was originally entered in as well. The additional manage can also be used as a way of rearranging the order of those reason for visits. I can also mark these reason for visits as a follow-up, and once I'm done, select Save and Close. To document within the reason for visit, I simply need to select the title, and Nexion is going to launch an HPI that is paired with that chief complaint. The provider is then going to come through and they're going to mark the boxes and document appropriately. Once they're done with this documentation, they can go ahead and select Save and Close. And Nexion will automatically take those selections and turn it into a dynamic text. Now the other thing to take note here is that you notice that the intake comments is in purple. This is letting us know that there's information residing within this link. And so if I select intake comments, I'm going to see the documentation that was entered in by the clinician. This is also a place that you can document as well if you're going in and discussing the chief complaints with the patient. And if you don't necessarily want to document in your provider's HPI, you can utilize the intake comments here as well. Once your provider is done documenting his reason for visit, then they can go on to review of systems. Remember that these were completed by the clinician during the intake process. If after speaking with the patient, if there's information that needs to be updated or added, you can do so by selecting that specific review a system, and this is going to launch that ROS for you. You can then make the selections needed or type in additional comments. After the review of systems, the vital signs that were taken during the intake will display in the grid below. If they are outside of normal range, there's going to be an alert indicating to the provider what is outside normal range. The next panel is going to be the physical exam. And the fastest way to document your PE is going to be the one-page exam. Now most providers are utilizing quick saves on this template as well, which means that whenever you see this radio dial here, if you select the radio dial, your provider will likely have specific physical exams saved that you can automatically apply to your patient and then chart by exception. So I'm going to go ahead and select Barco Adult Male PE Normal, select OK, and this is going to pre-populate these selections for me. I can then go through these selections and mark them by exception in the event that they need to be. Once I'm done, I can select Save and Close. The PE information now displays in a grid format. Again, if there's specific information that either got misdocumented or needs updated or added to, you can select the specific exam, and this is going to launch your template again for you to make those exceptions. Now you'll see again that there's this purple and blue font or text again. If you select the link, it's going to launch a more detailed physical exam for that specific location. When I'm done documenting, I'm going to select Save and Close. And now my line item is going to be updated on the grid. Once I've completed my physical exam, the next thing I'm going to do is go down to my assessment and plan section. This is going to be where the providers are adding in today's assessments or diagnosis codes, as well as orders and plans. So the first thing we're going to do is select assessments. And the providers can use diagnosis codes previously used for this patient, or they can search for a new condition as well. So in this event, I'm going to go ahead and search for hypertension. And you're going to notice that there's a plus sign icon, but then there's also this arrow. I call the arrow a drill down. And whenever a drill down is available, we ask that you utilize this. So select the icon. And this is going to ask for a more specific detail on this diagnosis. I'm going to select whichever one is most appropriate for my patient, and then I'm going to select the plus sign to add it to today's assessments. When it adds a diagnosis code, what I received here is a drug interaction. So it's looking at my patient's active med list, and it's letting us know that there's multiple drug interactions for this diagnosis. I'm going to go ahead and acknowledge those. And now my assessment is added to today's visit. I can then go on to my plan section for my patient. Down below here are the tabs that I'm going to follow. So I'm going to go ahead and jump straight to my AP details. I'm going to select my diagnosis that I'm specifically instructing my patient on, and I'm going to add those details to the patient box down below. This information here is going to show up on their patient plan document as well as the Master IM, and the provider details will only display on the provider's Master IM document. They will not show up on the patient plan, and NextGen even makes a note of that here as well. Some providers will utilize the impression and differential diagnosis box as well. There's not a right or wrong way of doing this, but you may see individual providers utilizing this template a little bit differently. So after their documentation is done here, I'm going to go ahead and just add in a couple items, common phrases here. Once I have my items selected and I've completed my plan details, I can then go ahead and move on to my orders. So up above here next to my AP details, the next tab is orders, and this is going to be where I can place any lab, radiology, or immunization orders. Now as medical students, you won't be placing these orders, so I won't be going through that workflow. However, I will show you after this how to view those orders in the orders module. The next tab over is going to be referrals. And again, this is something that the clinicians will typically enter in for those providers in order for them as well. The next tab over is office procedures. So these are going to be point of care tests. So in this event, if a patient were to need Toradol or Kenalog, any antibiotic injections, those sort of treatments can be ordered through this template as well. Once I'm done saving my orders, I can come down here to save and close. And then now you'll see that I have a patient plan attached to my assessment for today's visit. Now the next thing I want to go over is going to be the orders module that I just mentioned a second ago. So at the top here you have an icon for orders, and also down here on the patient history you have the same icon. Now these will take you to the same place, which is the orders module. And in my preferences I have the default view set to order summary. So that way I can quickly see what all has been entered in for my patient as far as immunization, labs, and radiology orders go. So for example, here you see these little icons here to the left. So this is an immunization icon, radiology, and labs. If I was reviewing a patient chart and wanted to see what kind of workup was completed on my patient, this is a quick and easy way to go through their order history and see what has been done for them. The other thing that you can do is over here on the left is the results tab. Any lab result that's being completed in-house and resulted, or coming back through the Quest Lab interface, those results will show here in this trending lab view. If you want to review the immunizations, there's an immunization tab as well. This is going to be age specific, so your pediatric patients are going to show the recommendations according to their age, as I have an adult patient here, so this is why I'm getting this current recommendation view. And so again, that's just the test tubes, which is going to be your orders module. Alright, the next item that I want to cover is going to be the medication module. So this little icon here with the RX that's located again at the top and also down on your patient history panel, this is going to be our medication module. So I'm going to go ahead and select this. And what I'm seeing now is the patient's active medications. I'm going to go ahead and just hide this patient history panel on the side here so you can see a little bit more of my screen. Your top section is going to be your active status, and down below are going to be your inactive medications. Keep in mind that the inactive status is actually more of an audit trail, which keeps track of any and all changes made to the patient's active list. As med students, you will not be sending in or prescribing any medications, so I just want to show you the view here. We have the medication name, the generic, how they're taking it, who's providing it, the original start date versus this start date. So the original start date is going to be the very first time that prescription was prescribed for that patient, and this start date is going to be the last time the prescription was sent in as a refill. Whenever you have a medication highlighted, it's going to show you down below a summary of that prescription. So here I can see the quantity and the number of refills that were sent in. If you're not familiar with one of the medications, there's a couple education tools that can be utilized. If you highlight your medication and down here by resources, if you select that drop-down list, there is a monograph available. And this is going to give you that overall drug information for you. The other option is going to be the PDR link here for you. So when you select your medication, you should have a full prescribing link here for you as well that will take you to the web-based PDR. So again, just a couple learning tools for you. And while I'm talking about learning tools, another item here is if you go up to File and Patient Education, you can also search for more information on your patient's either assessments, problem list, or medications, allergies, and you can search for those items through here as well. When I select it from their list, it will provide me with patient education material that may be helpful to you as well. When I'm done with this, I can simply select Exit, and now I'm back to my medication module. We're now done with the medication module, and so to get back to where we started off, you'll notice that there's tabs that have been saving across the top here. So to navigate backwards, all I need to do is simply hit the X to close out of these tabs. And now I'm back to my SOAP template where we were doing the majority of our documentation. Now the last thing that I want to show you in today's training is going to be a couple tools that may help you. And one of those is Care Guidelines, and the other one is the dashboard. And so let's look at Care Guidelines first. I'm going to go ahead and select this link. And what Care Guidelines is a standard set of protocols for patient care. And so what this does is it looks at your patient's diagnoses that have been applied within the last 18 months, and if there's a guideline for that condition, it's going to automatically apply it. Now our patients that are 18 and older will automatically have a health maintenance applied, and pediatric patients will have a PEDS guideline automatically applied. In addition to health maintenance, this patient had a diagnosis for hyperlipidemia and also a diagnosis for depression. Therefore, I see 2 additional guidelines for my patient. And so what I can do is I can look through this page view and see what guidelines or protocols. I can look through this page view and see what standard protocols are recommended for patient care. On the last page, you'll see that immunizations and specific screening tools will continue to display as completed, and this prevents end users from having to continuously look back through their history to see the date that they were last done. Underneath each protocol is going to be an interval and an age range, and it will also show a next due date as well. And so again, care guidelines is just going to be the standardization for patient care. Now the other tool that I want to point out is going to be the dashboard. Now this tool is looking specifically for what payers are requiring. Since we are part of the ACO, this is going to be looking for those measures as well. And so what you'll see here are these stoplights. Anything in green means that the measure has been met. Anything in red means the patient has not met that measure for the year. And anything that's clear is going to show that that's not applicable for this patient at this time. If I want to know more information on this individual quality measure, all I need to do is select the stoplight, and it's going to give me what that quality measure is and how do I meet that measure. Again, this is just another helpful learning tool, and the difference between the quality dashboard and care guidelines is that your quality dashboard is looking at payer requirements. And this concludes the training for today. If you have any questions, please contact the NCP department. You can call us at extension 2458, and we are happy to help. Thank you.